in the heart of Yorkshire.
Hello, emergency department.
An unbeatable team.
That way.
And stop, we're going to lay you down.
Hard at work 24 hours a day.
Does it count as a daily exercise?
7 days a week.
I can smell it now. It's a really bad burn.
Saving lives.
It might be that we need to put you to sleep in order to try and sort this out.
Helping loved ones.
It's a shocker, that.
Making the community they serve better.
We got you, lad.
You're being such a good boy.
A health service treating anyone.
Car door, house door.
Van door.
Big van door.
Yes.
So it's quite impressive, isn't it?
And everyone.
Oh, you're going to have a good black eye.
Are you doctor?
A team doing anything and everything for each other.
It's just been mental down here. I will do it. I'll get to it.
We're strong people in Barnsley, you know.
This is Barnsley Casualty 24/7.
You're absolutely all diamonds. Brilliant.
We fixed him.
On shift tonight, Physician Associate Adele.
Do you feel any better or still rubbish?
I can't run a marathon.
Dr. Josh Gemmell.
Let's get that bandage off and have a little look at it.
It's huge.
Yeah, right.
And back from maternity leave, Sister Benita.
You know the days at home where I were there and thinking, oh, actually, I miss work. I don't miss it anymore.
So, get ready to share a shift.
Oh, Mother! I know.
With the team at Barnsley Casualty.
Oh, that was a good one.
It's a hectic start to the afternoon shift for Sister Benita.
Hello, it's Benita. Hello, it's Benita. Hello, ED, it's Benita. We currently have 81 in department at 3 o'clock, which is quite hefty, actually. Coming on to 80 odd patients at lunchtime. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. We've got 15 moves. It's tough. It's really tough.
What's making it tougher still is that it's her first week back for over a year.
I have been away from our hospital for 12 months because I've had a little boy. This is, my second shift back now.
Being back at work is quite a shock to the system.
Are you okay? Doctors changed a while ago, but obviously I'm new back, so it's me getting to know the doctors and a lot of new nurses as well. I haven't met you, I'm Benita.
Oh, nice to meet you.
It's a challenge, and you've got to take it like that, because if you're going negative from the moment you've started, it's not good.
And now, the emergency red phone is ringing.
Hello, Barnsley A&E.
An ambulance is on its way.
Yeah, okay, what have you got?
A 75-year-old has collapsed in her garden. Barbara is in agony, and the pain relief hasn't kicked in.
So this is Barbara. She's been out in the garden this afternoon looking at the flowers, and she's gone to turn herself around and she's kind of just dropped at the floor. And then she's kind of just shuffled herself to a step, and then care staff at the place where she lives have assisted her up onto a wheelchair, but she's not been able to weight bear in her right leg.
So it is short and unrotated. And who's this? Who's with her?
A daughter.
Ouch.
Daughter Kerry is doing all she can do to distract her mum from the pain.
Broken hip usually takes several weeks or months to heal, but it can take longer.
Oh, no.
Why are we laughing? You'll usually spend around 4 months in hospital.
Get lost. No.
1 to 4 months. Oh no, wait a minute. 1 to 4 weeks. You will start having regular physiotherapy, and they'll tell you to quit smoking because it's bad for you.
Is that what it says?
No, that's what I'm saying.
Oh.
Barbara, I've got the doctor to request an x-ray, so we'll take you for an x-ray and then we can see whether it is fractured or not, and then we'll go from there, alright?
Cool.
Okay.
Take some hits off that if it's hurting. Get puffing on your gas and air.
I like to keep going, that's it.
Go on.
If Barbara has broken her hip,
Just breathe normal. Take deep breaths, but not like... There you go.
she'll need urgent surgery. She's fast-tracked through triage
Nuclear medicine.
and straight up to X-ray. And now, another emergency. Dr. Josh Gemmell is called over to Cubicle 1.
Right then, sir. So nice to meet you. My name's Josh. I'm one of the A&E doctors. So, can you just tell me a little bit about what's brought you in today?
I was sat at the kitchen table, and all at once it started like erupting. It's huge.
Yep. Right. Let's get that bandage off and have a little look at it then, sir. Okay. So it's quite impressive, isn't it, really?
We often see particularly older people coming in with some haematomas, often on the arms and legs, places where they're commonly going to bang themselves quite easily.
78-year-old former miner David is prone to bruising, but this knock has caused a haematoma so big that Dr. Gemmell needs to consult the specialist team in Sheffield.
Yep. Super. Cheers, mate. Bye now.
Bruising and haematomas are to all intents and purposes, the same thing. But with a haematoma, your risk of continuing to bleed after you've had an injury like that is going to be greater. And as that collection of blood starts to grow, it starts to lift off some of your skin.
Okay, so we're just going to make a little incision and then see what we can manage to get out, okay?
With the size of this haematoma, the risk of infection setting in is huge. David's entire lower arm could be at risk. Back in charge of the hub at Barnsley Casualty today is Sister Benita.
Hey up, it's Benita. Sorry to bother you. I'm just a courtesy, love, to let you know I've took over from Zoe.
It's her first week back from maternity leave.
Things have changed, doctors have changed. Is Dr. Oliver about? Oliver.
One thing that's not changed is how busy the department is.
A good handover, I guess, would be about 50 patients. Any more than that, you find yourself kind of pedalling before you've started, really.
Today, Sister Benita started her shift with 81 patients.
We've got no space. We're restricted bed-wise, we've got no beds. So it's just kind of now all coming to a halt. I am finding it tough, certainly, yeah. You know, the days at home where I was there and thinking, oh, actually, I miss work. I don't miss it anymore.
Back in Cubicle 1, former miner David has a giant haematoma in his arm.
Ecky thump.
But there's so much clotted blood, Dr. Gemmell needs a different set of tools.
When we're talking about a haematoma, what we're talking about is a large collection of blood under the skin. You may have had quite an innocuous knock on something that you wouldn't necessarily notice, wouldn't have caused any pain really normally. Probably get a very small bruise, if anything, that would be the end of it. Skin's a bit more fragile. Right now, boy. So it's quite well clotted. Obviously, we want to try and get as much of it out as we can do. You all right there?
Yes, keep going, don't worry. Oh, that's just...
Sorry, dude.
It's all right, keep going.
Tell me if you need a break, okay?
No.
No, you don't, or no, you won't tell me.
Both.
A lot of people of that sort of older, greatest generation, if you like, are, as you say, very, very stoic. They can be bloody stubborn as well. Very difficult to get them to accept the help that they need sometimes. Do you have any allergies to anything?
Yes, tweezers.
Yeah, good.
People jabbing in me. No, I haven't.
Often they're really, really chatty, really entertaining, have some fantastic stories, so they are really, really nice to talk to.
Like one big jelly's coming on.
It is, isn't it? Blackcurrant, my favourite.
Never eat it again. That's hurting that.
So,
Dr. Gemmell is struggling with the volume of blood clots.
Keep going.
it's quite large.
He calls consultant Dr. Asim Salim for advice.
I've basically spoken to plastics, and they've basically said they want all the hematoma removing, and they're going to see it. So many things don't present like a textbook. So having the ability to have senior support there on the shop floor when you need it is actually just really, really important.
One way of doing that is take out like a big 50 ml syringe.
Yeah.
Put a big red needle in top, and like a fire extinguisher, just put some water, wash it off, then dress it. Yeah.
Sure.
Yeah.
We've got a top tip from the boss as to how we can best do that. So just bear with me. For 2 seconds.
His skin is like tissue paper. If you shake hands with him, you mark him.
Oh, we can hold on. That's no problem.
But I haven't to squeeze.
David and Denise have been holding hands since they got married 55 years ago.
I wouldn't have thought you'd know anything. I'm over to bit.
But recently, it's been more in sickness than in health.
It's been a bad year this year, up to now. This is the third or fourth time I've been here.
The former miner is hoping this time it can be fixed for good.
My name's Rachel, Mrs. Answer.
Are you alright?
Well, yeah.
Ish.
Having an urgent x-ray on her hip is 75-year-old Barbara.
Okay, Barbara, take a big breath in for us now. Hold it there. And breathe out now, relax.
Her daughter's been trying to keep her mum's mind off the pain. But as she waits for the results,
Yep, all done.
the reality of what she's done
Thank you.
hits home.
I've never broken anything in my life. It is quite painful. It seems to be really stiffening up. But this is the worst.
If the x-ray shows she has broken her hip, it can take up to a year to fully recover.
Because I know it, I won't be able to go out. I like to go and have my walks in the fresh air. Even in rain, I'll go out and have a look. If it's only around the block, I'll go and have a walk. And if it's broken, that's going to put a big stop on that.
In the hub,
Hey up, it's Benita. Can I have a male orthopaedic bag, love, please?
it's not been the easiest shift for Sister Benita to come back to after her maternity leave.
I need some water.
X-rays training, it's taking ages for 7 around there.
Have they? I've got loads for it. They're all breaching for x-rays. We've got some new porters starting, which they have to go through their training as just like anybody else, but it can cause time delays. Hey up, love. I know Zoe probably escalated the issue earlier, but we've got loads of outstanding x-rays, so they're going round, but then obviously they're waiting around their ages because I think the training... To be honest, I wasn't aware that it was a training day until one of the porters come and let me know. It's just porters, love. So x-raying, and there's about 17 jobs outstanding for him.
17?
Yeah. it all has a knock-on effect. It's like a domino effect, really. This is the usual shift for me. Chaotic.
Trying to keep the chaos in check over in the children's department is paediatric nurse Greg.
Stop laughing, all I can see is you smirking in the corner.
Rather you than me. I hate running.
I can't run.
I can swim, but I can't run.
On tough shifts like today, his remedy is a big dose of positivity.
The day is what you make of it. And I think the team that you work with also really pulls you up and helps you make every shift enjoyable.
Did you do the Couch 5K?
I started it, but I didn't. The voices annoyed me.
Right, I can only find Sarah Milliken.
Well, now, pet, it's time to...
That's well, it's not Geordie.
Everyone's there for each other. It is tough, but we're here to help people.
That's an I for ice cream.
The next patient in need of help is Joseph. After an accident in the kitchen, he needed 3 stitches, and he's hoping today's the day that they come out.
And that's a set for flour.
He went to clean his own plate in bin and he dropped the plate and it smashed on your foot, didn't it?
Yeah.
So we had to come to hospital, didn't we?
Yeah.
This one. Oh, that was a good one. I'll be back in 2 minutes.
Taking stitches out is not something that we would regularly do in A&E. The fact it's so hard to get a GP appointment means that we are seeing more people coming back to have outpatient procedures done in our department, because you need to get the stitches out before the wound engulfs it and can potentially cause an infection.
And there's a non-medical reason why Joseph is hoping to be stitch-free as soon as possible.
And it happened the day before his birthday, and for his birthday he got a new pedal bike, which you couldn't go on, could you? So when these are out, we're going to hopefully get on your bike this weekend, aren't we?
Yeah.
Yeah?
I think he'd done well being so patient, managing to stay off the bike. But then obviously, if he got on, he could have caused his foot laceration to open back up.
All right, buddy, so I need you to stay nice and still for me. Okay, and if it's hurting, if you tell me, then I can stop and we can have a little rest, all right? But it's important you try and stay nice and still, is that okay?
Yeah.
Cool. You okay?
Yeah.
Right, that's the first one out. That wasn't too bad, was it? Was that okay? Do you need a little rest or do you want me to carry on? Did it feel a bit funny?
Yeah, so working in paediatrics, you have sort of got 2 patients. You've got your patient with the physical complaint in front of you, and you've got the parent. And I've noticed if the parents are very anxious and worried and upset, the child is more likely to be very, very anxious and upset.
Right, should we do the next one?
Should we count 3 and do it? Ready? 1, 2, 3. You okay?
That's the next one out. All right.
Joseph's dad was very encouraging and very, very kind to him. I think that made a massive difference in the treatment.
So this next one is a little bit tighter. All right, so I might need to pull it a little harder.
But it's the last one.
But it's the last one, yeah? And after that, we can go home, can't we? And that'll be exciting, won't it?
Ta-da!
Well done, matey.
I think children are very creative at thinking of ways to accidentally fall over and hurt themselves. And we see a lot of children who do very innocent, normal things and come out really worse for it.
You can pick 2.
I want that one.
Yep.
I think because I'm a big kid at heart, I'd always gravitated towards paediatric nursing.
You've got a new bike as well?
Yeah.
Yeah, what colour is it?
Red.
Oh, I still like play with Lego and stuff like that.
It's been lovely to meet you, but fingers crossed we don't drop any more plates, yeah?
Yeah.
Yeah.
Sometimes watch cartoon, I can't believe I'm saying this.
Does it feel like good?
Yeah.
Like a new one?
Yeah.
Very good.
Dr. Gemmell is having to try a different technique to help treat David's giant hematoma.
I could get a bottle of sterile water, maybe. Is that going to be the best thing to do?
Yeah, that would be easier.
Easier way to. And then pressure wash it.
Yeah.
Perfect.
That will be helpful. It will probably be less painful.
Yeah.
Good.
So the boss has got a bit of a suggestion in that It might be a bit more efficient to try and clean it out like a pressure washer rather than going piece by piece. So
Well, there's some coming out, isn't there?
yeah.
You're doing a grand old job.
I know I'm doing a grand old job, you are. You're never going to believe my pain, are you?
I'm doing the easy bits here. You're doing the tricky bit by not flipping me.
It's obviously very, very painful. It's a very large area. And once we remove the clot, or we are removing the clot, we've got this quite large area of exposed tissue underneath.
I'm doing a fine job up to now because I haven't swollen.
The new technique has definitely helped.
Right, we've got the majority of that clot bulk out now, okay.
But it means Dr. Gemmell can now see the full extent of the treatment David needs.
You need plastics, really.
And it's not something they can do here in Barnsley.
We don't always necessarily have the sort of the time or the specialist skill set to be able to provide some of those more specialist services. And this is where it can be a little bit challenging.
The plastics team covers the whole of South Yorkshire, and Dr. Gemmell needs to get David an emergency referral. Barnsley Casualty's bursting with patients this afternoon.
So we are down to 78. So 3 less than why not okay. Treading water. Hello, it's Benita.
Not the ideal shift for Sister Benita's first week back.
There's a few of us, I think, that have come back off maternity leave, and when I'm at work, I like to be at work, but it's really hard. And I know he's all right at nursery, but there will be people you don't really know. And it can be really hard. He's like my little shadow at home, so to come and leave him for 12 and a half hours. So 5:30 with me touching about while I was getting ready for work, so I thought I'd be knackered, come to him going to nursery, he'll like even struggle to stay awake going to nursery. He's not slept all day. It is heartbreaking, it really it is as a mum. He's put him on speaker, like on things so I could see him, and he's just like that glaring at me as much as to say, where are you?
But Sister Benita's having to put being a mum to the back of her mind for now.
Hello, Barnsley A&E.
Paramedics are bringing in another patient. And with the department this busy...
Are you okay, lovey?
She's having to treat this patient herself.
Right, Stuart, I'm Benita, one of the nurses. All right, so these guys have done me a huge favour and hooked you up already to some monitoring, but I just want to put some on your chest. Is that okay?
Yeah, of course it is.
And I know they've already asked you a ton of questions, but I just might reiterate some of those. Is that okay?
Yeah.
64-year-old Stuart's got a complicated health history, so getting to the root cause of why he's coming will be tricky.
What made you feel unwell first?
She had a break, and I couldn't get upstairs.
Couldn't, yeah.
And then I tripped upstairs and banged my head.
Oh, lovely.
And then I couldn't get up. I had no strength.
Didn't you?
I couldn't get up off the stairs.
What happened then?
I don't know. I couldn't lift myself up. I couldn't get up.
Oh, sweetheart. And then with your breathing, because you sound like you're working quite hard at the minute, has it been like that all the time since Sunday?
Yeah.
As a mum and a nurse, everything outside of you switches off when you're here, because you have to. You have to make sure that everything's functioning on a level where 80-odd patients are looked after and cared after properly, so nothing else can seep in.
Do you have any pain at the moment?
No.
No, you're not uncomfy. I don't want you uncomfy whilst I'm pottering about round you.
Just my legs to her back.
Is it both of your legs?
No, just my left one.
Your left one. I'm really bad with my left
It's
one.
like cramp.
It's a right mess, bless you, isn't it?
Yeah.
Has it got worse as well?
I just work with it. It's...
We need to make it a bit better, don't we?
Yeah. It's hurting now because I'm poorly like.
Sister Benita might look calm on the outside, but inside, it's a different story.
Oh, it's daunting. How can we make this man better? What's happened to this man? There's all these questions that kind of flip up into your head.
Are you weeing okay?
Yeah, but I have a problem with that. It was red.
Okay.
I nearly freaked out.
Oh, bless you. Have you ever had anything like that before?
No.
Once they're here, you have such a small amount of time to be able to kind of put that into context.
Here, lovey, you've got a lot going off, haven't you?
Yeah.
Bless you.
I haven't been able to get out of bed. I've had no strength.
No.
To get...
Oh, sweetheart. In a rough way, aren't you?
Yeah.
Although you felt rubbish, what in years made you phone them this morning?
Because my wife was getting on to me.
Was she? That's usually what happens, you know. You men are sticklers for leaving it too late.
Stuart and his wife are hoping they haven't left it too late to get the treatment he needs.
Look at that. It's sore.
Back in cubicle 1, David and wife Denise are waiting to find out when they can get transferred to the specialists in Sheffield.
You did well not to swear.
I've worked in pits for more than 30 years, I can swear. I normally do. But see, I've done well today, not to. I've been warned.
If you'd have sworn, I would have prodded him with this.
What we tried to do was remove as much of that haematoma as possible, get a dressing on it with a bit of pressure to stop that blood from recollecting. Obviously that's not quite been successful, which is why I think at this point, as we say, we've got no option other than to get the plastics guys, the specialists at Sheffield involved.
Oh, there you go.
Yeah, that'd be great, yeah. Cheers.
Dr. Gemmell manages to get an emergency appointment for David, but it won't be today.
Unfortunately, despite our best efforts to get plastics to see him today, which would have logistically been easier, they are going to see him on Thursday.
Discharged for now.
Right, well, shall we get you home then?
I think so.
Yeah.
Right, thank you very much, guys. Thank you very much for coming back for it. No problem.
When the specialists saw David, they kept him in overnight before letting him home the next day, back into the care of his wife Denise.
Come on, love, we're going home. We'll see to you at home, right? Okay?
Yeah. Bye.
Hello, it's Benita.
It's been a tough return to work for Sister Benita. Only just back in the hub, and there's a problem with the cold store, where they keep all the medicines.
Somebody's locked the fridge with the key at the top in the centre, and so therefore every time people open it now, it's scraping on the bottom and it's dragging, so he says that fridge door will eventually break if somebody doesn't unlock the key.
Any shift can be challenging, so when somebody says that the fridge is broken, it can a little bit in you tipple over, but you have to remain calm and ensure that everything else is functioning. So you sort it out and you move on.
You just want to pull him back up again.
Okay.
And is that to take a great load of stuff out? Because a lot of it's expired or whatever. So it will come down.
If I get 2 minutes, I'll have a look. Thanks, Aileen. It's never plain sailing. There's always something that essentially goes wrong. Right, okay. CT and review. Yeah, sound. Thank you.
In resus, 64-year-old Stuart is struggling to breathe and has a badly swollen leg. Physician associate Adele has taken over his care.
Stuart, hello, my name's Adele, I'm one of the physician associates. So you've been short of breath for 3 days, have you?
Yeah, and had no strength. I haven't been able to get off at bed.
Okay. I'd never even heard of physician associate until about 3 years ago. Let's have a listen at your heart then. We work exactly like doctors do. We just go through a different training programme. And your leg is quite swollen.
Yeah.
Has it always been like that?
It's always been not as red as it is now.
It's been more red since Sunday, has it?
Yeah.
What about pain? Is it painful at all, that leg?
At back.
At the back. Okay, okay. This leg looks like it could either have an infection or there could be a possibility that there's a clot in it. Okay.
If Stuart does have a clot in his leg, it could be a sign that something more serious is happening with his body.
Just having a look at his GP records to see what his past medical history is, just to get an idea of if there's any problems with his heart or lungs that we already know of.
Physician associate Adele suspects that all of Stuart's symptoms are linked. And she's right.
He's got a background of heart failure, so I'm looking for a few things from a point of view as is there any signs of infection or is there any signs of his worsening heart failure? Because the heart is like a pump, if it's not working properly, fluid can build up in the wrong spaces.
It's a worrying development. The priority now has to be on his heart and lungs.
Your heart rate's going quite fast.
I know.
You've got a bit of a temperature with us. I think there's some infection going on. Sounds a bit crackly on your lungs. We'll give you some antibiotics and we'll get you a chest x-ray.
Stuart is given some emergency antibiotics, but his history of heart failure has made the situation much more concerning. Back in the hub is Dr. Gemmell, who's only been working in Barnsley for a few months.
His trouser ties are so
Especially on night shift to get more dehydrated.
I haven't got the arse to keep these up. One of the reasons I like A&E is my attention span is maybe slightly on the shorter side, so I quite enjoy having lots of shorter interactions with people.
And his next interaction will be with 75-year-old Barbara, who's just back from radiology.
Here he is.
Hello. Is it Barbara? Nice to meet you, my love. My name's Josh. I'm one of the A&E doctors. The people are fantastic. I know this is a bit of a stereotype. Everyone from down in sort of London and the southeast is a little bit miserable, but I have found there is a grain of truth in that. It looks like it's fairly exquisitely painful. Is that right? Yeah. Okay. Up here, people are just more open and chatty on the whole, and there's probably involved more swearing. You've broken your hip.
Oh.
Okay.
Excuse the language.
Don't you worry. I think is a very fair reaction.
Well, it's
All
red in it.
I know. Hips are one of these things which do need fixing surgically. Okay, so that's going to need to be done by the orthopaedics team. I suspect they will probably look to do this tomorrow morning for you. And then we're just going to move you around the corner and we're going to try and give you a local anaesthetic block to the hip, which should hopefully help take the pain away for you. Okay. So I'm really sorry about that. I know it's a lot to take in, and probably not how you thought your day was going to go today, I expect. Okay. I think it's really, really important to remember the effects that these injuries are going to have on people. You know, it is a bit rubbish, really. There's no other way to put it.
As Barbara waits for a space in resus, Keeping her spirits up will be vital.
Oh, Mother!
I know.
How did you do that?
In resus,
Is this Stuart?
It is.
64-year-old Stuart is too poorly to go to X-ray, so the radiographers come to him.
When we take this picture, I'm going to call to you and ask you to take a nice big deep breath in, all right?
Yeah.
We're not going for any world record breath holding attempts.
It's been a worrying few days for Stuart.
I don't know what it is. All right, it's Sunday. And then it just come all of a sudden. I went to bed and I couldn't get upstairs. I had no strength to climb upstairs. Oh, that's lovely, that.
Is that a bit better?
That's lovely.
Stuart's X-ray has come through. Physician Associate Adele looks at the results.
Looks like he's got a chest infection, basically, and it looks very white around here. The heart is also enlarged, which suggests heart failure, which you know he's already got. And just generally it looks quite congested. Chest X-ray wise, looks like you've got some areas of infection there, but you've had some antibiotics to help fight that, okay, and you've got some fluids going through.
The medic is confident that she's addressed the most urgent of Stuart's medical issues, but she's still concerned about his leg.
How are you feeling in yourself? Do you feel any better or still rubbish?
A bit better.
A little bit better, but still not great.
No.
Okay.
I can't run a marathon.
Fine, okay. So, need to keep a close eye on you, okay? And I'll let you know what we're doing about this heart rate, okay?
With Stuart's medical history, Physician Associate Adele isn't taking any chances.
One of my consultants is just going to come along and have a look at that leg. It's hard to work out if it's red because there's an infection or red because there might be a clot in it. All right?
A clot could be a sign that Stuart's heart is failing. Again.
Oliver! Hello. I'm Benita, lovey. Sorry to bother you.
It's been a tough first week back from maternity leave for Sister Benita.
Not great.
She's having to juggle her hub duties with helping out in resus.
You are a darling.
Nothing's ever plain sailing. There's not much else you can do about it. You need to just keep going and make sure the patients are happy and safe.
Oh, that's lovely, that. Right.
Now Kerry will knock them out of the way anyway.
Don't know what you mean, Mother.
With no porters available,
You're going in resus now, Mum.
that's it.
You're doing the rounds today.
Dr. Gemmell takes matters, aka Barbara, who's had a fall, into his own hands.
I'm built for running and cycling, madam.
Is that it?
I'm not built for
you're
heavy lifting.
You're a cycler. Don't call me.
Shall I kick him, Mum, or are you gonna? No, you better not.
It's still at least 30 minutes before Barbara will feel the effects of this nerve-blocking procedure.
Oftentimes, patients are quite agitated, distressed, and in quite a bit of pain, so they sometimes move around a little bit. It can be a little bit tricky.
Ow, ow. No, it's not you, it's me. Ow.
Fortunately, Barbara's daughter Kerry is there to provide support.
My mum is the person with the highest pain threshold. I've never known anyone with a higher pain threshold than my mum, ever.
Just relax your arm now. If it's any consolation, it's kind of like a slight orange colour, so you just look
nice.
like the right-hand side of your tummy has got a bit of a tan.
Oh, lovely.
You've got an NHS tan.
Oh, but I don't
An
know.
NHS tan.
Right, okay.
A lot of these procedures are quite anxiety-inducing.
If we've got someone like her daughter there who can talk her ear off at the same time, have a bit of back and forth, that's really helpful from our point of view.
Oh, and it's a boy!
Get lost.
You're doing well. I don't think I've ever seen anyone laugh as much as what you are now.
Should have heard us earlier.
Imagine if you've ever had blood taken before, you start feeling a bit shaky and sweaty and clammy. Now, imagine a much, much bigger needle being stabbed into your pelvis. It's something which can cause quite a bit of anxiety.
So we're just going to inject now. Okay, sharp scratch. Stay nice and still.
I will. Ow!
Perfect. Keep going.
Can you feel that going in?
Tricky.
Should you feel some relief from that quite quickly?
So it's going to be about 30 minutes. Okay. Thank you very much.
But you're gagging for a drink though as well, aren't you?
Oh, you've got it.
You stick some vodka up in an IV or something.
Do you think that'd help?
They'll get it fixed, some quite intensive physio in the early stages, try and get patients back to a point where they're able to mobilise, try and maintain that muscle mass insofar as is humanly possible. And they are very, very good at fixing these hips. They do it a lot.
Barbara headed up to the surgical ward. The next morning, she had a total hip replacement and is hoping to get back to her regular walks very soon. Still in resus, Stuart's badly swollen leg has caused physician associate Adele to call down consultant Dr. Liz Doherty.
I just wanted to have a look at your legs, if that's okay.
Yes.
Yeah, have they been swelling?
Since I've been poorly this time,
Yeah.
at the back.
At the back.
It's like cramp
Is it?
all the time.
Yeah, on both of your legs?
No,
or
just this one.
just that one. Is it okay if I have a little look?
Yeah.
Yeah.
I'm just going to slide your pyjama bottoms up.
The consultant is concerned too. She needs to have a look at the x-rays.
It seems likely his leg is driving. It does seem likely it's infection there to me.
Okay.
All things considered.
Yeah.
There's nothing major there on his chest.
Great. Thank you for that.
There's some good news at last for Stuart. It's not his heart that's causing his breathing difficulties.
It seems most likely there's some infection that's got under the skin, what we call a cellulitis. But we're already giving you some antibiotics because we're wondering if there's some infection on your chest as well. And so we might just speak to our microbiologist, our specialist, just to check they're happy with the antibiotics we're giving you to make sure we've got you on the right ones.
Stuart was moved onto the ward and given new medication to target his leg infection. He was kept in for 10 days, but he's now back home.
We've got 73. Lost 10.
It's the end of Sister Benita's tough shift back.
We've achieved a lot, we have. They've worked really well, bless them.
Her thoughts can finally turn towards her other role as a mum.
When I get home, I go and give my little boy a hug. Even if he's in bed, I give him a little kiss and just make sure he's okay.
Hello. Hi.
And then I probably end up washing up, so there's... and the mum head goes on.
Hand it over. Done my job. To come back and do it all again tomorrow.
The end of one shift, but the start of another.
Here, at least at the end of the shift, you get to go home. As a mum, you don't get to do that.